Okay, good morning. Could you give me your name and designation just for the record?
Good morning, Mr. Simmons and all of St. Lucia. I am Derek Aarons. I'm a bioethicist. I'm actually the ethicist at the Caribbean Public Health Agency, CARFA, with headquarters in Trinidad. But as you probably know, CARFA takes care of all the public health needs of all the CARFA member states, including CARICOM, and which 24 member states that we have all across the Caribbean. So we seek to provide all the public health needs and support to the various ministries of health in all of those countries.
So explain what a bioethicist is essentially.
A bioethicist is really a specialist in the ethics of medicine, healthcare, research, and the life sciences. So all those fields carry very important ethical components, and so the ethicist provides the expert advice on all the dilemmas that one tends to meet in healthcare, in research, and in the life sciences.
So tell me, what is this workshop specifically going to be focused on, and the level of participants that you have? Could you explain why you've chosen some of the CMOs from the region? How important is this?
Okay. This particular workshop will be focusing on research ethics. So it looks at research because research is necessary, particularly in the area of health, because we wish to improve knowledge. We want to develop the expertise to be able to provide new knowledge to advance societies in general. And therefore, along with that research comes the ethical aspects to make certain that when you're enrolling persons in research, that their welfare is well catered to and you seek to minimize harm. And so there are particular protocols, international standards that have to be met in the area of research ethics. And so we find that as the area has developed internationally, us in the Caribbean are not aware of all the up-to-date things that are being brought into the consideration of research ethics. And so this particular workshop, because chief medical officers, CMOs, are responsible for all the public health within their particular countries, and that includes research, then therefore they should be cognizant, up to date on what are the requirements, the international requirements for research and research ethics. And so, sponsored by PAHO and CARFA, this particular workshop seeks to bring the CMOs in this region together, along with your local Research Ethics Committee, or IRB, some people are more familiar with that name. They really will be looking at research, what are the standards that ought to be met in research, how do you protect participants in research, and be aware of the dilemmas that exist in research ethics.
Now, this is a 3-day workshop. I know the CMOs really in charge of the Ministry of Health and what happens within there. But what about private physicians and private clinics? And we have many of them. Will there be an opportunity for them to be part of such a workshop?
Not in this instance. CARFA trains researchers in research protocols and in research ethics. But this particular workshop is designed specifically for research ethics committees, IRBs, in this region, along with the chief medical officers, so they know the standards that ought to be. Because you'll find that researchers, in order to conduct research, need to submit their proposals to the various countries' Ministry of Health in order to get approval to conduct research. And therefore, the CMOs or the research ethics committees ought to know what are the international standards that have to be met. And so we are reminding them and updating them in this regard as to what ought to be in each proposal, what faults may be there, how they should be corrected, and so they will be better equipped going forward to protect the welfare of every individual who is enrolled in research in their particular country.
So we have a number of medical universities on island, and some of them, as you may have read, have been coming to the news of late with certain questionable things. Is it that this particular workshop will also look at schools that have been set up to train persons in terms of medical sciences, that they are also up to date in terms of what they pass on to prospective doctors, nurses, and the like?
Quite true. Because centers of academia, universities, are at the forefront of doing research. You'll find that a lot of research proposals do come from universities, with the students, with the tutors there, or collaboration with the local community. So all of these persons need this type of exposure, but as we say, this particular workshop is just geared specifically to those that have to evaluate the protocols, the proposals, and then they can then filter down the knowledge that they have gained from this workshop. On the last day of this workshop, we'll be looking at setting up particular procedures that will be written that will guide each country on, one, the standards that ought to be met when you select persons to serve on your IRBs, research ethics committees, the international guidelines that exist, and how you should write your own guidelines to guide persons, because personnel may change, but once a guideline is written, people can refer to it as to what ought to be. And that is important both in terms of research with humans as well as human tissue and data that you collect from humans. And so those guidelines will be set, will be specified, will be actually, these CMOs that are here will compile these guidelines for their own countries, so they can go back to the various countries with these written guidelines. That will be the standard that all researchers should meet thereafter.
Okay, thank you very much. Yes, Miguel. Yeah, stop it. Okay.